Pre-op and post-op journey. Please follow these instructions carefully before and after your hair transplant procedure. Pre-op. 1. On the day of the operation, wear comfortable clothing. Nothing that will need to be removed over your head, such as hoodies and sweaters. It is ideal to wear button-up shirts. You may not be able to take this off for 3 days. 2. Wash your hair either on the day or the day before your operation. 3. Please eat before your procedure, and there's no reason to leave yourself starving as we only use a local anesthetic. 4. It's okay to have coffee or paracetamol if needed. 5. If you're a smoker, you must continue smoking as usual. 6. Please make us aware of any serious illnesses or allergies you may have, and any medications you are taking. Let the surgeon know of any recreational drugs intake, as they can interact with the local anesthetic. 7. Avoid alcohol, ibuprofen, any headache medicines and minoxidil-based medication, or finasteride 2 weeks preoperative. Also avoid caffeinated beverages, such as high-energy, high-portion nutrients and homegrown enhancements for 2 weeks before your procedure, as they can pose a risk to your health. 8. Please do not cut your hair before the procedure. 9. You can bring a smartphone or tablet to listen to during your procedure. 10. Please hydrate due to wearing a COVID-19 mask during the operation. 11. Bring hand gel with you for the journey to the clinic. Please be sure to follow these instructions carefully before and after your hair transplant. Preparation is key to the whole procedure. You will have a better experience, and some patients sleep during the operation. If you have any questions, do not hesitate to ask. Post-op. 1. For the first 24 to 48 hours after your procedure, you may need to take paracetamol or ibuprofen, as once the local anesthetic has worn off, your donor site may feel tight and tender. We advise you to take painkillers every 4 to 6 hours for the next 24 to 48 hours to decrease discomfort. 2. Please do not drink alcohol post-operative for 24 hours, as this will thin your blood and possibly cause minor bleeding. 3. You may experience slight spotting of blood in the donor site after the procedure. This is normal, and you should press on the area firmly for 5 minutes with the swabs provided by us if bleeding persists. 4. You must sleep upright with pillows behind your head for the first 3 days. Day 1 to 2 is regarded as the first morning after the completed procedure. For example, 15 to 20 hours after the operation has finished. Take your antibiotics prescribed by the surgeon and any other medications named. Your donor site will be a little sore, and please avoid picking and scratching the crusting on the scalp. We will provide a small spray bottle of saline where you will need to spray the crusts every hour. This will keep the scalp moist and assist with any irritation. You can use still mineral water, but not tap water. It is possible to also experience forehead or eyebrow swelling. This is normal and can be reduced by taking it easy. For instance, laying back rather than sitting upright when reading or watching TV. You can remove your head bandage the day after the procedure. Spray the dressing with water before removing to avoid any unnecessary bleeding at the donor area. If any bleeding occurs, apply a small amount of pressure with a swab or sterile wipe. Wash the back of your scalp to remove crusting blood. Keep young children away from you for the initial 2 to 3 days post-operative to prevent any strikes to the recipient grafts. Keep out of direct sunlight to avoid pigmentation problems. Day 3. You can now wet your hair. Stand under a gentle shower with lukewarm water for about 5 minutes. This will enable the water to soak the crusts, but please do not scratch or use any shampoo yet. Leave your hair to dry naturally, using only your fingers to style it. Dab on it gently with a soft towel. Please do not rub. Complete 2 or 3 times a day. Any forehead swelling will now peak but will disappear over the next few days. Day 4. You can now wash your head with mild shampoos, such as baby shampoo. Soak your hair for 5 minutes. Follow up with a shampoo. Gently put it on top of your head, allowing the lather to run over your head. As you do this, slowly move the hand over your whole head. Leave the shampoo for at least a minute and wash off, as instructed in Day 3. Day 7. Visit Baruch Hair Loss Clinic Pudsey, Leeds for your first hair care management plan, which entails 25 to 50 minutes of low-level laser therapy, microscopic analysis, and discussion of the healing post-op. Antibiotics course finished, photographs recorded, and model release forms signed if appropriate. You will visit weekly, bi-monthly for the following 6 to 12 months. Day 5 to 10. You can now shampoo daily. It's recommended you apply shampoo to the back of your head, away from your grafts, and work gently into a lather, allowing the soapy suds to run into the grafts. Please do not pick the crusts. It can be tempting, and please do not be surprised if one of the grafts comes off with the loose crusts. This is normal. Shampoo daily. Day 11 to 14. It would help if you still avoided any heavy lifting or exercises until the 2 weeks are over. You can exercise gently for the first 4 weeks of post-op. Day 14 to 6 months. Now that your scalp is healing and your donor's hair feels a lot more comfortable, you can have a haircut. Do not cut it too short to begin with, and not with an electric clipper with a setting any less than 4. Over the next 6 months, the individual hairs will start growing and begin to get longer each day. It's important to note that the hair does not come all at once and will be a gradual process over the next 24 months. Once your hair has grown to a reasonable length, you can continue treating your hair as usual, such as dyeing, washing, drying, and cutting it. It is completely normal to not see any growth at all for at least 3 months post-op. It will often take around 6 to 9 months before you start to see thick hair growth. It is also common for the hair to grow for a few weeks and then begin to shed 4 weeks into the post-op before it begins regrowing again. Many patients feel anxious waiting for growth, a normal emotion. You have done all the hard work, and now it has paid off. Congratulations! Mr. Sean Jordan Baruch, Baruch Hair Loss Clinic Limited, and Dr. Mohammed.